Hello viewers, welcome back to my channel. In today's video, we will explore the SDTM intervention class domain, that is the concomitant medication domain. So let's get started. In a clinical study, a subject is exposed to many drugs. That is, the subject takes many drugs during the trial. Now the question arises is that which drug should be classified as your study drug or the concurrent medication. Within the concomitant medication also, we also have the prior concomitant medication and the rescue medications. So taking an example here, let's understand how we can identify that which drug taken by the subject can be categorized as study drug and which can be categorized as concomitant medication. Right now I'm taking an example of a clinical study which is testing the drug A for high blood pressure, which is hypertension. Any study drug which is taken by the subject will always be categorized as your exposure information and it will be captured in your EX domain. So in this example, the study drug A will be populated in your exposure domain. The subject which is enrolled in this study is taking the drug A to reduce the high blood pressure. But during the trial, if this subject faces any headache or fever or any other medical problems which are not related to the study treatment, then the subject might take some medications. Let's take an example that for headache or fever, the subject has taken paracetamol. Then this paracetamol is going to be populated as a concomitant medication. Why? Because concomitant medication is any drug or treatment a subject takes in addition to the study drug during the course of the trial. These medications are usually taken to treat the pre-existing conditions such as diabetes or to manage any effects caused by the study drug or any unrelated reasons for the study drug. So in this case, paracetamol can be categorized as the concomitant medication. In addition to this, if the subject is also a patient of diabetes, then any medication which the subject is taking for diabetes will also be categorized as your concomitant medication. So talking from the concomitant medication point of view, again, as we said that the subject is diabetic, then it is understandable that the subject might be taking some medication to cure or or in response to diabetes before he or she was enrolled to the study. So we can consider the diabetes drug, say for example glimi medication which we normally take for diabetes, then the glimi medication will be considered as the prior concomitant medication as well. Why? Because the subject was taking this drug before he was enrolled in the study. So any medication which the subject was already taking before getting enrolled in the study, which is also not the study drug or related to the study treatment, then that particular medication can be considered as the prior concomitant medication. The prior concomitant medication taken by the subject can be continued during the trial and it can also end during the trial as well or before the trial as well. But if the information is relevant for safety analysis point of view, we will capture it as a prior concomitant medication. Another example which can be categorized as prior concomitant medication in this case is the ethanol which the subject was taking before for previous BP medications, but he has stopped taking before the study starts. Now comes the question of the rescue medication. Which medication should be considered as the rescue medication? Right now, in this example, this study was for the hypertension patients, the patients who are suffering from high blood pressure. So if during the trial, the drug A, which is our study drug, is not sufficient or effective enough to control the hypertension problem, then a rescue medication might also be given to the subject. Rescue medication means a medication which will help in curing the disease under investigation. In this case, hypertension is the disease which is for which we are testing a drug. Then any drug which will be taken by the subject to cure hypertension can be considered as the rescue medication. So now in this example, clonidine is the medication which was given or taken by the subject in response to high blood pressure spikes in spite of taking the drug A. So this drug can be categorized as the rescue medication. Let's understand how the CM information is captured on a CRF form. Taking this CRF form as an example, in this CRF form, we can see that we have a free text box for the concomitant medication. If the response to the question, were any medication taken, is yes, only then the investigator will be able to see the remaining questions of this form. In other words, if the response to the first question is yes, then the rest of the form will become enabled for the investigator. Otherwise, this form will not be enabled, and the subject data for which the investigator is entering the data will not have any CM records. So once this header question, the where were any medications taken, yes or no, is given a response, say yes, then the remaining information will come, and in this you can see that the medication question is a free text form where the investigator can fill the concomitant medication which the subject has taken, and this information will go to CMTRT. If this information which is entered by the investigator is in a proper classification or the proper standard value, then we will not need the CM modify variable to populate in our SDTM dataset. But in case the medication which is entered by the investigator is in very layman language, then to identify and code it to the proper CM decode value, we will have to convert the layman wordings of the CMTRT entered by the investigator to a verbatim term. For that, we will use the CM modifier. The next question in this CRF form is the indication, whether this was the primary study condition or the prophylaxis or non-therapeutic use. So that indication will be mapped to the CM indication. And the rest of the form has the information where the investigator will tell that the concomitant medication taken by the subject was in what dose and what was the dose unit, how frequently the subject has taken this drug, and how this drug was administered to the subject, and when it was started, and whether it is ongoing as or not, and if it is not ongoing, then what will be the end date. Please note that here for the ongoing question, when the response is yes, then we are also populating the CMENRTPT as ongoing. This is a reference variable where it is referred based on some value, some date values, and based on that value, we will see whether the CMTRT is ongoing or not. And if it's ongoing, then this CMENRTPT will be populated as ongoing. This form is an example where the CMTRT is captured as a free text, but there can be a CRF forms where the CMTRT is pre-populated in the CRF form, and if the subject has taken any of those CMTRTs which was specified in the CRF form, then we will have another variable which is the CMPRESP annotated on the CRF form, and if the subject is taking, then the CMPRESP will have the value of Y, and if in case the subject has not taken that medication, although the CMPRESP will be Y, but the occur value, CM occur value will be N in this case. We will see an example on how the CMPRESP and the CMACR is populated for the CRF form where the concomitant medication is pre-specified next. Now let's understand the population of the CMPRESP and CMACR in the CRF form. When any CM medication is pre-specified in the CRF form, then in the CRF form, in front of that particular medication, we will have either a radio button or a checkbox. Normally, if the study allows to take multiple concomitant medication at a time, there will be a checkbox in front of all the medications listed down in the CRF form. So right now I'm showing you an example where one subject took concomitant medication from the pre-specified forms of the concomitant medication. So let's assume that in that CRF form, these three medications was specified. Those three medications are Zoloft, Prozac, and Paxil. All these medication will be populated in our CMTRT. Now the questions come of the CMPRESP. Since these medications were pre-specified in the CRF form, so for each subject, we will have one record for the pre-specified medication and the CMPRESP will be populated as Y for those medication. Now the question comes is whether the subject has taken this medication or not. If the subject has taken any of the pre-specified medication, then the investigator will check the checkbox in front of the medication which the subject has taken. So in this example, from the CM occur value, we know that Zoloft CM medication was taken by the subject. The CM occur is Y. That means that this pre-specified medication was taken by the subject. And when the CM occur value is N, that means that the subject did not took this medication which was pre-specified. So for Prozac, we have the value N populated as the CM occur. Now see the third scenario where the CM occur value is missing. So what does that mean? That means that at the site level, the investigator did not had an answer or a response to the information whether the subject took the Paxil medication or not. So that's why he cannot fill either Y or N. So in this case, that was populated as missing. Now the question comes is that why this information was not available. So in this example, this information was not available because the investigator was not able to ask the subject whether he took this medication or not because of some interruption. And this reason is populated as CM reason in the CM domain, and the CM stat is mentioned as not done, which indicates that the investigator was not able to question for the Paxil medication intake from the subject. So in this way, we can see that how the CMPRESP or CM occur will be populated along with CM stat and reason in the CM domain. That's all for today. If you find this video helpful, don't forget to like, share, and subscribe for more content on SDTM domains, ADAM, and clinical SAS programming. Comment below if you want us to cover a specific domain or topic next. Thanks for watching.